Alright guys, so today we'll be talking about HIV prevention. I'm sure everyone watching this video knows what HIV is all about. So we'll be looking at HIV prevention, the drug approach in HIV prevention, and the non-drug approach in HIV prevention. So before we dive deep into this topic, let's briefly look at what HIV is, the mode of transmission of HIV, the signs and symptoms that come with HIV and AIDS, and the mortality and the prevalence rate of HIV in Nigeria. So I have a very important question I want to ask you viewers today before we kick off this video. Did you know you can actually be infected with the virus and still have a fighting chance against the virus within the first 72 hours of exposure or contact? Did you know this? Yes or no? I'm sure most of you viewers didn't know this. Now there are ways around this, and the only way you're going to know is for you to stay tuned to this channel and watch this video to the end, because there is a very important and sensitive information I want to pass to you viewers today. Very sensitive and important information, so please don't go anywhere. Stay tuned. What is HIV? HIV is known as the human immunodeficiency virus. It's a virus that attacks your immune cells that help fight off infection. Now, there is no cure for HIV, but there are antiretroviral drugs out there that we can use in the management of HIV. So let's briefly look at the mode of transmission of HIV. Number one, through unprotected sex with a HIV positive person. Number two, through exposure or contact with a HIV positive blood specimen. Then number three, from mother to child. Yes, a HIV positive mom is at a high risk of transmitting the virus to a child during delivery. Let's briefly look at behaviors and conditions that can increase an individual's chances or risks of even contracting this virus. So let me just quickly read them out for you. There are more shares, so I'll just briefly read the important ones so we can move forward fast. So number one, having condomless anal or vaginal sex. Number two, having another sexually transmitted infection such as syphilis, herpes, chlamydia, gonorrhea, or bacterial vaginosis. Now, number three, engaging in harmful use of alcohol and drugs in the context of sexual behavior. Now, number four, sharing contaminated needles, syringes, and other injecting equipment and drug solutions when injecting drugs. Number five, receiving unsafe injections, blood transfusion, and tissue transplantation and medical procedures that involve unsterile cutting or piercing, and experiencing accidental needle stick injuries, including among health workers, meaning even those of us that work in the health system, we are even at a higher risk of actually contracting this virus if we're not careful enough, especially when handling HIV positive blood specimen. So for those of you that feel that HIV is not real, that feel that HIV is a spiritual something, please, I have some statistics that I'm going to share with you on this video today. So basically we'll be looking at the mortality and the prevalence rate of HIV in Nigeria. So let's briefly look at it. Now, this statistics was published on August 24th, 2022 by Statistical Research Department. Now, they have this to say: as of 2021, about 1.9 million people in Nigeria were living with HIV. That year, the number of deaths due to AIDS amounted to 51,000, including both adults and children. The highest number of deaths was recorded amongst female, with 17,000 deaths. So from that statistics I just read to you viewers, do you still feel HIV is not real? Do you still feel HIV is a spiritual something? Please, we really need to be careful out there. We have to be very, very careful, because HIV is real and HIV is around you. So we've come to the crux of today's topic, the most important part of today's topic, which is HIV prevention, which is basically one of the reasons most of you actually tapped this video. I'm sure most of you people are gingerly right now in your body, spirit, and soul that part when he said you can actually have this virus and remove the virus in the system within 72 hours. That is the part I want to know. don't be wasting time. Let's just go there. I want to know the name of that drug so I can go and buy one full carton and keep in the house and start swallowing. Oh, my brother, calm down. My sister, calm down. I'm going to tell you everything you need to know about HIV prevention. So let's look at the drug approach in HIV prevention. Now, in HIV prevention, there's something you need to know. The same antiretroviral drugs we use in the treatment or in the management of HIV and AIDS, the same antiretroviral drugs can also be used to prevent HIV. That's the virus itself. Now, we have PrEP, that is PrEP, meaning pre-exposure prophylaxis. Now, we also have PEP, meaning post-exposure prophylaxis. Now, when we use the word prophylaxis, we mean prevention. The word prophylaxis means prevention. Now, there are regimen for PrEP, there are regimen for PEP. So let's briefly, talk about what PrEP is. So let's talk about PrEP, or pre-exposure prophylaxis. Now, PrEP is an antiretroviral medicine that is given to an HIV negative patient to help prevent HIV infection. Now, this pill is meant to be taken once or twice a day. It comes in a combination of tenofovir or entricitabine. Now, if PrEP is taken the right way, it can help prevent HIV infection by 44 to 90% of the time. Now, who is actually eligible to take PrEP? Or those individuals that are at a very high risk of contracting this virus. Number one, men who sleep with men. Yeah, men who sleep with men, or women who sleep with women. Now, number two, the sex workers. The sex workers, you know what I mean by the sex workers. They are at a very high risk of contracting this virus, so they are also very eligible to take PrEP. Now, number three, for patients that have partners that are HIV positive, they are also very eligible to take this drug. So the CDC, that is the Center for Disease Control, is aimed at reducing the spread and the prevalence of HIV. And we can see that in certain African countries like Uganda, where PrEP has been implemented in different health centers, where individuals can actually go and take these tablets or these injections. Especially for the sex workers, there is a depot preparation now. What I mean by depot preparation, an injectable you can take and will last in your system for a period of 2 to 3 months. So I'll just briefly play a clip so you see.
Ugandan sex worker Hajira Bate knows to put her health and her life ahead of money and to reject clients who refuse to wear condoms. But even for those who are careful, like Bate, contracting HIV, the virus that causes AIDS, is a high risk.
We had many issues with condoms because sometimes condoms burst, and sometimes because of the nature of the work we do and the dangers of the work we do, sometimes we can see, sometimes there are incidences and scenarios where sex workers are raped.
To reduce the risk of AIDS, Uganda last year launched the daily use HIV prevention pill Truvada. Uganda's Ministry of Health says there are 8,400 people using Truvada, including sex workers. The pill is up to 90% effective, but only if users can get past the stigma and maintain the routine of taking it every day.
So let's talk about PEP, or post-exposure prophylaxis. Now, PEP means taking an antiretroviral medicine after a possible exposure to HIV. Now, PEP must be taken within the first 72 hours of possible exposure and should be taken only in emergency situations. PrEP comes in a combination of 3 antiretroviral drugs. Number 1 is tenofovir, number 2 is entricitabine, and number 3 is dolutegravir or ratigrapher. Now, the tenofovir and the entricitabine comes as a single pill, while the dolutegravir also comes as a separate single pill. So basically, you're taking 2 pills, either once a day or twice a day. So considering the side effects of the drug, sometimes your doctor might prescribe you take the tablet once a day, or most likely twice a day. So it all depends on your doctor's prescription. So who is eligible of taking PEP or post-exposure prophylaxis. Today I'll be talking about 3 criteria that make you eligible of taking post-exposure prophylaxis. Number 1 is the health practitioners, especially the lab scientists that handle, blood specimen all day. So, for example, you as a lab scientist, you're handling an HIV blood specimen, and you mistakenly, used a syringe that has been, that has come in contact with that blood, and you mistakenly used that syringe to pierce yourself. That's a risk of exposure. That's a possible risk of exposure, and you're eligible of taking PEP immediately within the first 72 hours or as soon as possible. Now, number 2 is having sex with an HIV positive individual. Number 3, cases of sexual assault. Now, in case of sexual assault, most of the time you don't even know the person who sexually assaulted you, and then again you don't know the person's HIV status. So you are eligible of taking PEP as soon as possible. You have to consider that as soon as possible to eradicate any form of HIV infection. So I keep saying the first 72 hours. Well, the first 72 hours doesn't mean if you know you've been exposed, you have to wait for 72 hours. No, that's not it. You take PEP as soon as possible. You run straight to the hospital as soon as possible. You make your complaints, tell them what happened to you, tell the doctor what happened to you, and they will have you being placed on PEP as soon as possible. Now, PEP is meant to be taken for 28 days straight. Yes, you take PEP for 28 days straight. Now, if you went to the hospital, let's say exactly 72 hours after exposure, you might most likely take PEP for 30 days. Yes, you might most likely take PEP for 30 days. So thereafter, once you're done with the duration of the 28 or 30 days, then you can go for testing. You can test your HIV status. Thank you. So that's what I meant by how to, prevent, or how to treat, or how to cure, HIV within the first 72 hours. It wasn't a clickbait. It wasn't a clickbait at all. If you're exposed, you know that you're exposed. Don't sit in the house crying. Don't sit in the house feeling sorry for yourself. Go to the hospital. There's still a chance for you to get rid of the virus. So, in conclusion, PEP is effective, but not 100% effective. So it's very important that you initiate PEP immediately you know that you have been exposed or you've come in contact with the HIV virus. Now, it's also important for you to note that while on PEP, you should consider using other HIV preventive methods, such as the use of condoms while having sex. And while you want to inject drugs in your system, use new and sterile syringes and needles only. Thank you very much. So we've come to the end of today's video, but the next video I'll be doing a Q&A on this topic still, because there are so many questions that have been unanswered on this video. So please, I would like to know your thoughts in the comment section. And if you enjoyed this video, I know it was a little bit lengthy, but if you enjoyed this video, please give the video a like and share it to a friend. It's very important to share this video to your friends, because this video can actually save a life or save someone from depression and anxiety. Thank you so very much, and God bless you all.
Yeah.